Hi everyone. The question for today is a 4-year-old child was brought to pediatric OPD with history of a mass protruding through the vagina, and on examination the child showed the following. So this is the appearance, wherein you have a large mass, a polypoid mass with grape-like vesicles protruding through the vagina, and the histopathology showed presence of cambium layer. Which of the immunohistochemical marker can be useful in this condition? So to summarize, so this is basically a child who is having a mass protruding through the vagina, which is grape-like, and the biopsy finding, to some extent they've given there is presence of cambium layer. So how can you confirm the diagnosis of this tumor? So you should have something running in your mind, then only you can guess what's the marker. So any young child with a polypoid mass, like a grape-like mass through the vagina, always think of a sarcoma. And this particular histological picture is characteristic. It's a tumor. So this is the lining epithelium. Okay, beneath these you have all these blue cells, which are tumor cells. When you see beneath the epithelium, the tumor cells are condensed. They are a little bit very thick beneath the epithelium. So this we call it as a subepithelial condensation. So this subepithelial condensation of the tumor is what we call it as a cambium layer. It's called the cambium layer. So cambium is a layer which is present in plants. So it will be like that. So we call this as a cambium layer. Okay, subepithelial condensation of your tumor cells is what we call it as a cambium layer. Okay, so where do you get which sarcoma will show cambium layer? So let's see about that. So you have a tumor called rhabdomyosarcoma. So rhabdomyosarcoma is a tumor which arises from the muscle. So its of origin is from the muscle. It's usually from a skeletal muscle. So here what happens, you have different types. One is called alveolar type, then you have pleomorphic, then you have something called embryonal. So especially this embryonal type of rhabdomyosarcoma occurs in the mucosas, and they usually protrude through the vagina as polypoid mass. So because they protrude like these polypoid mass, they are called sarcoma boteroids. So sarcoma boteroids is nothing but embryonal rhabdomyosarcoma which produces grape-like vesicles. Boteroids means grape-like vesicles. So having told that this is a rhabdomyosarcoma which is going to be of origin from the muscle, what's going to be your marker which can help in the diagnosis? So go back to the question. So you should know about what are the markers you can use for what sort of disease. So here you have cytokeratin. Cytokeratin is a marker for epithelium. It's an epithelial marker. So usually carcinomas are positive for cytokeratin. If I say a squamous cell carcinoma, an adenocarcinoma, they will be positive for cytokeratins. Of course, you have different cytokeratins, cytokeratin 7 and so on. So that's for epithelial origin. Whereas if you take HMB45 and melania, where have we heard about this? Melanomas are usually positive for this. Whereas desmin and myogenin, they are positive for tumors of skeletal muscle origin, especially rhabdomyosarcoma. What is this? LCA, leukocyte common antigen. This is positive in lymphomas. Okay, so now what's the answer? So your diagnosis is clear cut. So your diagnosis here is a tumor of originating which is from the muscle. So your answer is desmin and myogenin. So the answer is an embryonal rhabdomyosarcoma which was cambium layer. So one point which I have to add here is, you all would have heard about something called small round blue cell tumors, like your primitive neuroectodermal tumors, your lymphomas. Alveolar rhabdomyosarcoma is also a small round blue cell tumor, and you have a mutation or a translocation which is positive in this condition, that's called PAX3/7 FOXO1 translocation. So this is the molecular translocation which is seen particularly in case of alveolar rhabdomyosarcoma. Why you should know this? Because recently you have some targeted therapies, so drugs which can target this fusion transcript. Okay, so you have to know about this translocation, and it has got a bad prognosis. Alveolar type has got a bad prognosis. Okay, thank you.